I'm Elizabeth Henderson. I'm the founder and CEO of Samata Health. We are a digital platform connecting users with therapists at discounted rates. It's a problem everywhere, especially in high-cost cities like New York, that only half of mental health care providers in the US take insurance. It leaves a lot of people without accessible options. And so we've negotiated discounted rates with all of our therapists that are less than half the average cost of therapy in New York City. We launched our consumer product March 3rd, 2020. Immediately within 3 weeks after we launched, the shelter-in-place orders came into play and obviously pretty quickly started to have an impact on people's mental health, and anxiety was particularly high around that time. The thing that became clear was that, first we were lucky we were able to offer teletherapy through all of our therapists really seamlessly, but that there were a lot of people who weren't going to be able to afford our out-of-pocket rates. And so we started offering 50% off discount probably around March 21st, and then offered that until just a couple of weeks ago. 50% off discount wasn't something we were able to continue on a sustained basis, but we think we were able to really help people have an access point to therapy during that time and sort of get some support during the very most critical point of the crisis. Therapists are really asked to sacrifice a lot and are sort of asked to offer their services in a way for free. Unfortunately, therapists are small business owners and a lot of them can't do that. And so they're really excited to have ways to offer clients relief through us, because it can be really awkward to negotiate things. And for therapists, it can feel a little weird to be running discounts and specials. And so we sort of take some of that awkwardness out of it. For some people, it's financial stress. For some people, it's health and family and health of their family. And others, it's just maybe mental health challenges that have been there for a bit, but are easier to hide when your life is a little busier. And we're all kind of having to sit with ourselves now in a way we haven't previously. Think of mental health as beyond just yoga and meditation. Something sensory like cooking or painting that gets you into your body and out of your head is often great for anxiety, or just going outside each day if you can for 5 minutes. Things like that you don't see as necessarily mental health care can be almost as impactful. And we also allow users to filter therapists by things like cultural competencies and even things like racial or ethnic background, because it can be really hard for people of color or a certain religious background to find a therapist who sort of understand their cultural needs. And we know that a lot of communities being impacted the hardest right now by coronavirus are communities of color, and we want people to know that we exist because we've found that to be one of our biggest value adds for our users so far. So if anybody is looking for low-cost therapy, then check us out, and we would love to help you. And I am sure, somebody on our platform who would be a great fit.